I'm Mahanur Yusuf, and I graduated from Harvard Business School in 2016 with a PLDA. I'm also co-chairing Harvard in Tech Seattle chapter. Harvard in Tech is the official Harvard University-wide alumni group for technology. We hope to further the development of technology through encouraging innovation, providing resources and networks, and promoting technological activity throughout the Harvard community. I'm here with Roger Hackett, my fellow alum, to present a discussion session with Mayor Kate Gallego of Phoenix. Mayor Gallego is the second elected female mayor in Phoenix history and the youngest big city mayor in the United States. She is a fellow alum, graduated from Harvard University and earned an MBA from the Wharton School of Business at the University of Pennsylvania. Before being elected to Phoenix City Council, Mayor Gallego worked on economic development for local utility company Salt River Project. Mayor Gallego has focused on three key policy areas during her time in office: diversifying the economy, strengthening infrastructure investment, and working to make Phoenix a leader in sustainability. Her record of proven results includes leading the campaign to pass Phoenix's citywide transportation plan through 2050, which was the largest local government commitment to transportation infrastructure in the country when it passed in 2015. She has led efforts on criminal justice reform and ensuring equal pay for equal work. Mayor Gallego is passionate about building a Phoenix that works for everyone and improving the quality of life for all Phoenicians. Phoenix is the fifth largest city in the United States and is currently the fastest growing city in the country. So today's discussion will be centered around reopening the economy during COVID-19 pandemic. We will explore what are the precautions needed to reopen the economy, what kind of support needed in city, state, and Fed level, and also with the changes, how do we prepare ahead for technology infrastructure and services needed? Roger, would you like to introduce yourself, and then we can move on to our discussion?
Hello, I'm Roger Hackett, and I'm a Harvard alumni of HES 2018, and I'm the president of Ryan and Robbie LLC, where we publish children's books and make smart plate systems for bilingual families. So let's go ahead and get started. Mayor Gallego, we'd like to start this talk by asking you to tell us a little bit about the current state of COVID-19 in Phoenix.
Thank you so much. Thank you for having me and for having this important convening. It's so valuable for us to be able to connect digitally and share information in such unprecedented times. The Phoenix metro area had one of the first 5 cases of COVID-19 that were diagnosed in the country, although we are constantly learning it may have been here longer than we knew. So we were up and responding fairly early and trying to set up systems. We now have 7,000 cases in Arizona. We have seen general declines lately in the community in terms of new cases, and we do have capacity in our hospitals, although yesterday, as we record this, we did see a significant increase in cases. So it's not a clear trend line, although there is, we think, some positive trend lines. We are way behind in testing in Arizona. So we just got Health and Human Services testing last week. Most large cities have had large-scale federal testing for longer than we have, and that's been a real source of frustration for me. As we have mapped data about where COVID is right now, we have far more cases in our higher income areas than our lower income areas. As mayor, I'm nervous that the data does not accurately reflect the reality that testing is not occurring where it is most needed. So many of our essential workers are not in the zip codes that have the highest levels right now, and so I am concerned that they are being exposed and have it, but don't have as much access to testing. Just this week was the first time we had a good testing option for people who don't have cars so much of the testing in Arizona was drive-up testing. Very understandable why we're doing drive-up testing. It is easier from a logistics and safety perspective, but still a great challenge for people who use our transit system. So we are also in the state with a good portion of the Navajo Nation, which has had one of the most significant outbreaks anywhere in our country. It is an important tribal neighbor to the city of Phoenix. Also, as a parent, how do you educate your child if you don't have good access to broadband? So I think about all the challenges I face as an individual right now. I have a 3-year-old, and just making sure he is able to be occupied and happy while I am doing my job as mayor. Without internet, I don't know what I would be doing, frankly, right now.
Okay.
I'm grateful to folks like Roger who provide technology solutions to help us educate our kids while they aren't in a more traditional setting. But I also am mindful that not everyone in Phoenix and not everyone in my state has access to that right now. And I should say he's at daddy daycare right now, so I don't think he'll be joining this Zoom discussion, although he has made appearances on many during COVID-19.
Okay, great. Mayor Gallego, can you speak a little bit to the support you're getting from the federal government? You also spoke a little bit to the diversity and the complexity of the demographics of Phoenix. So can you maybe speak also to how it's the aid that you're receiving is reflected in the different groups there?
Absolutely. So Phoenix is the 5th largest city in the United States, and as of last census updates, was the fastest growing right now. A very diverse city, a majority minority city. 40% of our community is Latino, and we have, like most American cities, a huge diversity of language needs. We, as a large American city, do receive direct aid from the CARES Act. Only cities above 500,000 receive that. It is for new expenses, so we can use it to buy protective equipment, which has been primarily how we have used it so far. We have allocated $20 million for protective equipment, but had huge challenges with obtaining it. We've had multiple orders where we've had them diverted by the federal government. We've had orders that were critical safety equipment for our police and firefighters that were not as promised, so not the safe equipment that we need to protect those who are doing such heroic work. It's been fascinating in the mayor's office because I think every day I hear from a different lobbyist who knows someone in China who could get us protective equipment, but we also get really blatant and depressing fraud where people will be like, from a Gmail account, be like, I can get you N95 masks, please wire money.
Oh, no.
And what a world we live in. This is critical safety equipment for people who are protecting us and others trying to profit off of it. An N95 mask we purchased for 85 cents before this began, and now we're getting bids around $6.
Oh my.
We've had some tough discussions about price gouging here. But the federal aid is incredibly important to us as a community. It is only for new expenses, and that's a real challenge for us as well. Phoenix is very dependent as a city government on sales tax. So our general fund, which is what pays those police and firefighters, as well as the people who work at our parks, other key city services, more than 70% of it comes from sales tax dollars. We do not have a food tax in the city of Phoenix. So as people have been spending less, we are very worried about what that means for our city budget. We don't know yet in a definitive way because we don't actually even have full March data yet, although we should, now that we are officially in May, learn soon. So we've been trying to use technology, cell phone data about how much people are visiting retail establishments, other economic data that's available. One silver lining for us is that we recently became able to get sales tax from online purchases, and we do believe that will be helpful in keeping the city going. We've done significant cuts and hiring freezes, but we have not yet done layoffs or furloughs like many large American cities and small as well. Very hopeful that Congress or the Treasury Department will give cities the flexibility to use those dollars to pay firefighters, police officers, and others who are on the front lines of fighting COVID-19. But it is an uncertain time in city government. We are being asked to do so much more with so much less. Yesterday we've allocated millions of dollars for small business assistance, and yesterday the City Council unanimously approved another increase in Phoenix. Our biggest expenditures so far during COVID-19 have been to fight homelessness and to provide support for our most vulnerable. But huge challenges ahead and uncertain resources.
Okay, so I know we're opening here in Seattle and in other cities around the country. Mahanor, I know you had some questions about how we do that safely, and I think we should maybe move to that now.
Sure, Rogers. Just to follow up on your comment, Mayor Gallego, what role can public and private partnership play in assisting Phoenix?
Anyone who has stayed home or changed their business to slow the spread of COVID-19, thank you. It's been wonderful to see the curve bend in Phoenix. We are slowing the spread, and as a country, we are slowing the spread. People have made enormous sacrifices in their daily lives and economic well-being, often to save the lives of people they may never meet. But anyone who has done anything to slow the spread and give our healthcare system a fighting chance, thank you. And provide service and move the economy forward without in-person meetings, that we can both continue as a community and slow the spread. So we just invested in some virtual inspections for our planning department. So if you get a new sewer line at your house, you can have it inspected and go out with your phone and show the inspector, and that way the inspector and you cannot be transmitting virus. It also turns out that you are much more likely for the inspector to arrive on time because you don't have to worry about getting lost or navigating. Much of Phoenix is geographically quite large. We are larger than 500 square miles, and we are building a lot of new subdivisions. And sometimes a homeowner may be putting in something new in a subdivision that isn't fully yet reflected on Apple Maps. So if you can do virtual inspections, that helps us in many ways. We've seen huge increases in people submitting plans online and other uses of technology. We are still struggling with moving all of our meetings online. I had a failure as mayor this week. I scheduled an epidemiologist to give us an update on the curves in Phoenix, and he did just an extensive presentation with lots of graphs, but I failed to think about that there are a few of my council members who aren't using WebEx. They are just calling in because of some technology challenges that they face, and how incredibly boring a presentation of graphs would be if you cannot see the graphs. So lots of technology challenges, and we welcome people who have the expertise particularly to provide city services in a better way online. We hope that will be one of the good things that comes out of COVID. One particular interest of mine is telemedicine right now. Phoenix operates the 911 system for our entire region of Maricopa County. 4.5 million people, also, at least as of last census, the fastest growing county in the country. We would love to be able to serve more people through telemedicine. It makes so much sense with the COVID-19, but generally as well. Sometimes we roll entire fire trucks or ambulances when something might be able to be solved through telemedicine. And I think that's the type of investment we can make during COVID-19 that will help us be a stronger city when we emerge. So we're really looking at that. I'm trying to learn from Los Angeles and some of the other cities that are ahead of us on telemedicine. And you are in that space, that would be particularly timely for us to hear from you. Mayor.gallego@phoenix.gov.
All
Okay.
right.
So let's talk about data privacy and security. Right, on April 30th, South Korea reported 0 new local cases for the first time since February. After flattening the curve, they were able to reach this tremendous result by mass rapid testing, which is free, and a comprehensive digital enabled contact tracing. So what do you think about balancing privacy rights as compared to the right to life, liberty, and the pursuit of happiness when it comes to contact tracing for COVID-19?
I was on a mayor's convening with the mayor of Seoul in South Korea, and it's just so impressed by how they have been able to get testing done. For me in the mayor's office, I would say the two things we hear the most right now have been, I can't get the protective equipment I need to do my job, and I can't get a loved one tested. So I will get panicked messages, often from people who I know, who say, my grandfather or my baby has COVID, but I can't get a test. I need the mayor to help me. And it just breaks my heart. I want everyone in my community to be able to get a test. We have spent so much time on the phone with our testing partners, and they have stepped up in getting to where we can test people who are sick. But that mass testing, it's not even a question for us right now. We have so far tried to be very respectful of privacy. For example, we have partnered with Arizona State University on testing our first responders. Many of them had concerns about how the university would use their data. And so we've said it is only voluntary. There are employers who are saying you have to get tested, but we've decided this should be on a voluntary basis. Many communities have had discussions about, should we have policies for if you have antibodies, you can go back to work. As mayor, I've really relied a lot on a partnership with Bloomberg Philanthropies and Johns Hopkins University School of Public Health that is providing data to mayors. And they've connected us with Tom Frieden, who ran the Centers for Disease Control. His advice was you shouldn't do policies where you get tested to be able to go back to your job, that actually encourages people to want to be infected. And right now, we as a society should want to slow the spread of COVID, not incentivize people to get it. So his advice was, we don't want chicken pox parties where everyone goes to someone who has COVID-19 and tries to get sick. Particularly, the 3 largest cities in each region of Arizona were the first to move forward. Flagstaff, Arizona, and Tucson, Arizona, as well as Phoenix. When I did my executive order, I got a very diverse response. Arizona legislators went out. My executive order closed bars except for takeout or delivery at 8 p.m. And economic development organization, all of who said, we have to give our healthcare system the fighting chance to get through this. We do not want doctors to make heartbreaking decisions about who gets treatment and who does not. Our business community leaders really supported me, our largest employers, and that was really valuable to me as mayor. It is a hard decision to put these restrictions in place in your community. The owner of an Irish restaurant who supported me in my campaign told me if he could not have St. Patrick's Day, he might never open again. I have an economic development background. I have an MBA. I want businesses to grow in my tenure. And so it is a hard decision as mayor to say, we are putting these restrictions in place, but I feel like we have to protect people's lives, and then we can work with them on their livelihoods. So I feel it was a good decision, but a hard one. Our governor in Arizona did follow with a similar statewide order a few days later. And then on the 31st of March, we went to a stay-at-home order. So we were late among states to go to that. I think we were maybe 31st. He did this week extend it. And I think that was a very responsible decision. I know one that was very hard for him. And I applaud him for taking it. So we are still staying at home in Arizona. We do have open space. So Phoenix has more acres of parks than any other any other city in America. And I felt like we could social distance. Again, consulted with the folks at Johns Hopkins, and they said that recreation is valuable and that being able to get out, they thought was a responsible trade-off.
Okay.
So we closed parks facilities where we thought it might encourage density, such as playgrounds and the sports courts and things that bring people together. But we are saying that it is safe to hike, although if you see crowds, please go elsewhere. It's not been perfect. Many people have been responsible. Not everyone has been responsible. So like any decision we face, there are trade-offs.
Okay. Yeah, I know my son, he's excited that he's going to get to go hiking now again here in Seattle starting May 5th. So it's great that at least we're getting back to some level of normalcy, and if we're smart about how we go out and do our hiking and stay apart from each other a little bit more than we would normally like to, maybe with this we'll get better faster. So to the next question I want to ask, it really is something that you've already spoken to a little bit, but maybe we can speak a little bit more about, and that is, we've seen from the New York Times some of the socioeconomic divide. Specifically in Chicago, we saw 72% of the deaths who are coming from the African American community. We've seen outsized African American community deaths in New York City as well. And you mentioned that the Navajo Nation is having had some at least significant problems in the early stages of this. So I was wondering if you could speak to a little bit more about how in Phoenix you're thinking about these different groups and these different communities, their access to healthcare, or what exactly are the factors that are making them more susceptible to the virus.
It feels like any gap that existed before COVID-19 has just been widened by the virus. So the challenges we had before are even greater today. I have been spending a lot of time recently on access to testing for all socioeconomic communities, a real challenge, and one where I am proud we finally got breakthroughs where we got testing where you don't have to have a car, testing sites on bus lines, and testing in lower income communities, although I don't want to in any way say that we're done, but that's, to me, having good data is so essential for me to make decisions as a policymaker, but for a parent to make good decisions as well, or a child about their parents or grandparents. So I've tried to go through COVID-19 a little bit in triage mode. I really started to start with the social distancing and slow the spread, and then focus on testing and getting good data out there. We also, as I mentioned, are thinking a lot about people experiencing homelessness right now. We learned a lot from what Seattle did. Seattle was ahead of us and moved more quickly on hotels, which was not something we thought of until you did. And so the City Council did approve going into partnership with the hotel so that we can get our most vulnerable people experiencing homelessness into safer, more isolated, not isolated, but where you have not in congregate living, and so that you are less likely to spread the virus, and good bipartisan support for that. I don't know, I guess in Seattle, bipartisan may not be an issue, but we have a very diverse city council in Phoenix. So we bring people together across demographics. As we've launched our small business program, we've started with low-income census tracts. It appears with the Paycheck Protection Program and other federal programs that larger and more sophisticated companies have had an easier time navigating that. we have we talk about companies that may be underbanked or not have a banking relationship, and it's directly. And we did start with the grants. It's what we heard from companies that were already small and perhaps serving lower income communities before, that they wanted grants because they didn't have a line of income to be paying back the loan. And it's been cool to see some of the companies that have come in, just fabulous restaurants. You read the list and you just get very excited for takeout. We have allowed takeout the entire time in Phoenix, and that's been a nice way to support our restaurants on the go.
We've really needed our takeout for it just gets to be a lot, just making meals every single day for, so many weeks now. And you're used to having those, and now that you can, it's just one of those, it's like, it's hard to complain about it because we have our health, but at the same time, it is something that we just feel blessed when we get to go to a restaurant now. So Mahanor, let's get to our next question about the future.
Right. So how do we prepare for the months ahead and predict the needs of consumers and companies with the growing demand for technology infrastructure and services?
We believe that many of these steps towards moving services and meetings online will persist long after COVID-19. Sometimes because it has actually really, people have discovered things like telemedicine, and now they don't want to go back, or they feel like, at least in certain situations, it can be more convenient. And so we will be investing in that in Phoenix, and I suspect other cities will as well, so that I think online education will continue to be important. We are going to be working with our chambers of commerce and economic development organizations to talk about supporting the industries that have been hardest hit, retail, hospitality, tourism, and supporting them as they return. We believe that making sure we have good safety precautions in place and explaining to residents in a clear way is very important. We want people to feel confident in returning to establishments when it is time, and we want that confidence to be appropriate. So we need good scientific programs for safety. We need data-driven evidence about what is safe and when. We've heard from business leaders that temperature checks and distancing may be with them for quite a while. And so we are going to need a much more significant public health workforce. We have a company in the Phoenix metro area, Passport Health, which was the largest provider of travel immunizations. And now they are pivoting to try to support particularly large corporations who are bringing their employees back to work and want to reduce risk. So it will be testing as well as support for temperature checks. So I don't know exactly what the future holds, but I hope that we will make decisions based on good public health data.
Okay, thank you. I do have a follow-up question. This is beyond the typical role of the city, but I would really like to hear from you the role of global collaboration to future challenges. Perhaps you can advocate a few suggestions. For example, like the Operation Enduring Friendship, a positive story of collaboration, cooperation, and friendship during the pandemic. Governor Hogan of Maryland obtained 500,000 coronavirus test kits from South Korea instead of waiting for assistance from the federal government. Right, Governor Hogan was able to leverage this, his wife Yumi Hogan's connection from South Korea. So if you can just address this, please.
Wonderful, thank you. It has been wonderful to see collaboration across our planet, and one of the inspiring moments of this. I have been proud to be part of global networks of mayors and have learned so much from other mayors. I mentioned earlier that we were able to talk with South Korea and learn from how they ramped up in testing. And after talking and hearing from the mayor of Seoul, I put much more of my effort into testing. Part of the way we've been able to get both protective supplies and a little bit on the testing side is through our international partnerships. Phoenix has sister cities in Chengdu, China, and Taipei, Taiwan. And we have leveraged those relationships to get protective equipment for people in our community. So we're grateful for those international partnerships. We've also learned from their responses to COVID-19. We really, really do appreciate that support. Although I guess as I have also seen the value of local manufacturing as well. The city of Phoenix on our airport property has partnered with Honeywell and taken what was vacant space, and now they are manufacturing N95 masks locally. So although we are very global, it is also comforting to drive by that facility and know that the masks are in your community, and we hope less likely to be diverted as they
that is very assuring, right? Excellent.
So,
great.
Global and local, I think, is
Yes.
my message. We have to have both. I hope that we will continue to have immigration, which I think will help our economy get back on its feet, and that we continue to celebrate our international neighbors and work together.
So we have heard a little bit about immigration being an issue with having outsized effects in other places. Is that the same case in Phoenix?
An immigration in terms of COVID-19?
Yeah, in terms of COVID-19, having immigrant populations being more susceptible. Are you seeing some of that in Phoenix as well?
So we do not have great data on that right now. It is something that I think is possible, but I have not seen it reflected in the data. In Arizona right now, we do not require people who are conducting testing to collect a lot of data beyond zip code and positive, negative, and that has made it much harder to use the data to respond. There's certainly correlations between zip code and other demographics, but I would rather actually have the demographic data.
That makes sense, yeah.
So in the majority of cases, we do have some age demographic data, but we don't have much beyond that.
Okay, so before we wrap up, what message do you want to send out to the public?
Thank you to everyone who has changed their life to fight COVID-19. I know anything that was stressful before COVID-19 is likely to be much worse now. If you are in a situation that feels unsafe or that you need to talk to someone, please do so. In the healthcare system, I've been reminding people you have to be your own best advocate. If you know you need care, please go forward and get it. Please continue social distancing. The Centers for Disease Control recommends that we have 14 days of downward trends before we make major changes. We want to open up the economy when COVID-19 is on its way down, not on its way up, because we don't want to increase the spread. So I know you've made enormous sacrifices and it's been very difficult, but I want to say thank you for the lives you've saved.
Thank you, Mayor Gallego.
Thank you.
And thank you, Roger. So it is remarkable how significantly all of our lives have changed over the past months. We hope you and your loved ones are staying safe and healthy during COVID-19. We are grateful for the connection and strength of the Harvard alumni community. Thanks to your generosity and support. Hope this video will bring in some thought-provoking discussion. If you're interested in learning more, please join us at LinkedIn Harvard in Tech, Seattle. Thank you.